Dr. H at the hospital. Dr. H used to work as a doctor in a hospital. That's a picture of him right there. But recently, he had to go to the hospital as a patient. For many years, Dr. H has had a disease of the digestive system, which starts here at the mouth and goes all the way down here at the bottom. The digestive system includes the stomach, small bowel, and large bowel. After many years of difficulty with this disease, he finally made an appointment with his doctor to talk about having surgery. The date for surgery was set for July 11th. Surgery is an operation where a doctor cuts the skin or other organs with a scalpel. A surgeon is a doctor who does surgery. On the day of surgery, he woke up very early in the morning, 4:30 a.m., to take some medicine. His wife drove him to the hospital at 6:15 a.m. He arrived at 7 a.m. When he arrived, a nice lady registered him with the hospital, which means he signed a lot of papers. Then they made him a patient ID bracelet to wear on his wrist. Then they brought him to a small room near the OR, operating room, where many people prepared him for surgery. Then he took off all his clothes and put on a paper hospital gown. Next, a pretty nursing assistant took his temperature, weighed him, and took his blood pressure. Then a nurse started an IV, which is a long needle that goes into a vein, so doctors can give patients medicine during a procedure. The OR nurse, the anesthetist, and the anesthesiologist came into his room and asked him some questions, and they answered some of his questions. The OR nurse helps the surgeon during the surgery. The anesthetist and the anesthesiologist put patients to sleep during surgery. Last of all, the surgeon came in to talk to Dr. H. Then they wheeled Dr. H to the operating room. He was asleep before he got there. The surgery took about an hour. Then his wife drove him home about noon. For many days after the surgery, it was painful for Dr. H to walk, cough, or laugh. But after several weeks, he slowly got better. But in the end, he thinks it will all be worth it. The end.